Do you feel a pinch in your hip when squatting? This will hurt your lifting and may cause hip or low back pain. This classic hip pinch sign is often referred to as hip impingement. However, sometimes it can be something else causing the hip pain and not actually hip impingement, regardless of what the x-rays say. How do I know this? Because my name is Dr. Grant Elliott, and we've helped thousands with back pain and sciatica fully recover through our one-on-one online coaching program, and tons of people we work with have hip pain and have been wrongfully diagnosed with hip impingement or given the wrong plan for this pain. So in this episode, I'm going to teach you how to self-diagnose if you have hip impingement or not, and how to fix it either way so that you can get back to squatting or whatever else you want to do pain-free. Before I show you a simple diagnostic test for hip impingement, let's first understand what hip impingement actually means. There are three types of hip impingement: cam, pincer, and mixed. A cam impingement is when a bony growth has formed on the top of your femoral head. This will rub the hip socket, called the acetabulum, and cause irritation. The pincer impingement is when the acetabulum has additional growth or over coverage of the femoral head, causing rubbing and irritation. A mixed impingement is a combination of both. There are three effective diagnostic tests you can do on your own to determine if you might have hip impingement. The first test is Faber, which is flexion, abduction, and external rotation of the hip. You lay on your back, cross the affected leg over, putting the foot above the knee. Now press your knee down, or have a partner assist you and assess for reproduction of symptoms. If the same pain is reproduced in the groin or front of the thigh, then this is a positive test. The next test is Fader, which stands for flexion, adduction, and internal rotation. This was designed to have a partner assist, but we can still do this pretty well on our own. Lay on your back, raise the knee of the affected side up, bring your knee towards midline, and now internally rotate your hip. If the same pain is reproduced in the groin or the front of the thigh, it's a positive test. And lastly, if you have impingement sign, which is simply pain in your groin or front of the thigh that is exacerbated by activity or sitting long periods, this increases your likelihood of true hip impingement. If these tests cause pain, keep watching. If you don't really feel pain with these, then I'm going to show you what to do a little bit later. Hey, real quick, I know you're struggling with pain and obviously want to fix it. So if you just text me the word pain to 317-751-9509, I will send you my free back pain fix demo. Just text that number and you can fix your pain. Thank me later. Back to the show. So for those of you where these tests reproduce the exact pain, we are pretty sure the hip is the source of the pain. So what can we do about it? I have 3 banded mobilizations for you to create more space and movement in the hip so that we can get you back to moving and exercising pain-free. For the first variation, we're going to grab a band, anchor it to the side of you, get in a piriformis stretch position, and wrap the band around your inner thigh. Now, while the band is tractioning your hip towards the anchor, rock your hip up and down to further mobilize the piriformis muscle and hip joint as the band continues to create space during this motion. Oh, and in this video, I'm not using a strong enough band. It's just the band I had available during the time I was filming this. You will definitely want to use a very strong and very thick band that has enough force to pull your hip hard enough. It takes some decent force. Now for the second variation, lay on your back, anchor the band directly to the side of you, wrap the band around your inner thigh, and pull your knee up so your hip goes into flexion. This is creating space in the lateral direction while you're mimicking the motion of a squat. When we squat, your hip goes into flexion, so we want to improve this exact motion. So if you get that pinchy sensation when you squat down, opening the hip and freeing it up in this exact motion could really help. And for the third variation, now we're going to traction the hip in a downward direction. On your back, anchor the band beneath you. Wrap it around your uppermost thigh. Now pull your knee up into hip flexion again. Once again, this is creating a direct traction force on the hip as it moves into flexion, further improving this squat motion and giving it the room it needs. Now here's the kicker. If you have true hip impingement, you still need to utilize functional hip exercises for stability and proper movement patterns of the hip. These mobilizations alone won't do all the work, but can be great additions for a better squat warm-up. Now there is something else you need to know, especially if you don't feel a strong increase in symptoms with those previous tests, but you still have this nasty hip pain. Here are the 3 most common types of issues that could be coming from your low back or other nerves that could be creating pain in the hip region. First, let's focus on a very localized, acute, pinchy pain in the front of the hip. Instead of just assuming this is hip impingement, many times this can be entrapment of the lateral femoral cutaneous nerve of the thigh. For this, you would want to focus on soft tissue work that involves movement right in that crease that is formed when you raise your leg up. This could be different forms of massage, manual manipulation of the tissue, or even cupping type effects, but there's many ways that you can do this on your own. Another nerve-based issue that can cause pain around the side of the hip or the front groin region is something called Main's syndrome. These nerves originate around the thoracic thoracolumbar junction, which is where your thoracic spine meets your lumbar spine. They can be irritated here, but cause pain around the hip or groin. So for this, you would want a treatment approach that focuses on this thoracolumbar junction, not focusing on the hip itself. Remember, just because the pain is one place does not mean the problem is in that same place. Finally, disc or sciatic nerve issues can cause pain around the hip as well. If your femoral nerve is being impacted by a disc, you can have radiation down the front of your thigh. Other classic sciatic nerve referral can go into the glute or hip as well. This pain can commonly be increased with simple tests of the hip, like internal rotation or crossing one leg over the other, and can trick people into thinking that they have a hip issue. But really, these are very common sciatic nerve symptoms. So if your hip pain is actually from one of these sources, those banded mobilizations I showed you earlier will do absolutely nothing. This is why having an accurate assessment is absolutely crucial to understanding what is causing your pain and how to fix it, which is why our clients get on average 37% reduction in pain during their very first session using our centralization process, and sometimes completely eliminating their pain within as little as 15 days, because you actually know what the problem is and exactly what to do to fix it. So you aren't guessing what exercises to do on YouTube. And if you want to see if you can get pain relief this quickly too, following my centralization process, just text me the word pain to 317-751-9509 to get a tailored step-by-step plan to permanently fix your back or sciatica issues using my centralization process. Do it right now so you don't miss the opportunity to finally get rid of this pain and live the life that you deserve. What costs more, doing nothing and staying in the same place, or taking action and doing something about it? The people who are ready to get out of pain are texting me right now. And after you do that, please like the video, subscribe if you haven't already, join my Facebook group, RehabFix Low Back Program, for more free content, resources, and guides. Thank you so much for watching. I'll see you on the next one.